Hi, I'm Dr Caroline Catt from Sydney Ophthalmic Specialists. We're doing a quick video for the benefit of patients and parents who've been asked to check their vision at home. If we do want you to do this, we'll send you through instructions on email, and we just thought we'd go through in a video as well to make it all a bit easier to understand. So we're going to start at the point where you've downloaded the app which we recommend, which is the EyeSight Pro app, which is this one here. So we're going to open that up, and you get a choice. We want you to choose the sight charts, move on to the next program, and we want you to choose whichever is appropriate. So for younger children who don't know their alphabet, you would choose K pictures at 3 meters. For older children who do know their alphabet, we'd suggest K letters also at 3 meters. And then you can begin the test. First thing we do is ask you to scroll through until the point where you can select this option of a single letter in the box. You can't choose it straight away, but if you scroll through the chart, at this point here, you'll be able to select that. This is the thing that we think you should use to check your child's vision. So we want you to start with a big letter, and we do one eye at a time, and if your child wears glasses, we want them to wear the glasses, and we'll go through that in closer detail soon. But start with the biggest letter, and then go smaller, and each time your child gets a letter right, go smaller again, and go smaller again, and go smaller again. There'll come a point where your child starts to struggle or start to get the letters wrong, in which case give them a few different options. And if you're getting them all wrong, then you know they can't see that line. But if they can see the one beforehand, which they were getting correct, that is the score of your vision. So the way to score your child's vision is to determine where was the last line or the last letter that they were getting correct. And you look in the top right of the screen, and there's 3 numbers up there. The bottom number, which is a 6 on something, is the result of their vision. So if they're getting 6 on 15 letters correct, then you'd score the vision as 6 on 15. And if they're getting the 6 on 12 letter wrong, then they don't get 6/12, they get 6 on 15. So it's really important that you test your child's vision or your own vision one eye at a time. And it's really important that you make a note of which eye you're testing. As a matter of routine, we'd recommend covering your left eye to assess the vision in the right eye first of all, and then switching the process, covering your right eye to test the vision in your left eye thereafter. If your child wears glasses, it's really important that they have their glasses on when they're doing the vision test. Some of you might be patching at home, in which case you'd have some little AutoPad patches, and you can use those to occlude the eye. So you take the backing off, stick it on the skin underneath the eye, underneath the glasses before you measure the vision. Alternatively, you can use a tissue on the palm of your hand and make sure it's fully occluded all the way around so you don't accidentally peek. Or you can also fold the tissue over the glasses lens and put it back on. You want to make sure it's fully occluded so you're not accidentally peeking. The brain will always find the path of least resistance and use the stronger eye if it's not fully occluded. So once the eye is fully occluded and you've got the glasses on, you could then start the testing, and you want to move back to 3 meters away from your child, which you could estimate as 3 really big steps, or you could get out the tape measure, and then you can start using your phone with that large letter, asking them to report the letter. In younger children, you could use the K pictures and ask them to report the pictures. So we would have emailed you a sheet on which to record your results. We're just going to show you how to go through that now. So it's all pretty self-explanatory, but when it comes to the visual acuity, if this was the smallest letter that your child saw accurately, then you want to record 6 on 9.5, and you want to make sure you've got that for the correct eye. So say that was the right eye, we get you to write 6 on 9.5 for the right eye. And in the left eye, say that this was the smallest letter that they saw, then you want to record 6 on 6 and make sure that that goes under the left eye. If your child is a glasses wearer and they did wear their glasses for the test, which is what we'd recommend, then make a note of that. It can also be helpful if you rate your child's cooperation. So if your child was super accurate and super confident for each eye, then you could tick good for both eyes. If they were really confident for the right eye, but got a bit bored and got a bit disinterested for the left eye, then you might give us a different rating there. That can just help us determine the accuracy of the results. Thanks for listening. If you have any questions, then please refer back to the email, or you can always give us a call and we can run you through the finer points. Good luck.